The Business Sector Advocacy Challenge Fund, BUSAC, has helped businesses to surmount daunting challenges. This have hampered their successful flow. The fund has broadened the engagement of the private sector in policy formulation, contributing to the creation of more enabling environment for development and growth of the Ghanaian private sector.
BUSAC Fund is promoting this. This role is the link between the private sector at the roots, which are working day to day on a concrete basis on their production selling activities, and the authorities at the level of the district, at the level of the regions, at the level of the ministries.
BUSAC Fund is the Business Advocacy Challenge Fund, which was set up with the support of the NIDA, DFID, and USAID. And the purpose of the BUSAC Fund was to establish a platform by which the private and the public sector could work together on key advocacy issues that aim at improving the business environment of the private sector.
We want to alleviate poverty. We want to focus on how can we get our support to become inclusive. We are working with the private sector, but to alleviate poverty and to support the vulnerable groups in Ghana.
We provide support to BUSAC Fund because we all agree that the future of this country, the future of economic development in Ghana is through the development of the private sector. So BUSAC Fund has a very important role in advocacy to promote business climate which is conducive for private sector development, which will be conducive to promote job creation through the private sector.
We have a number of steps that they have to go through. First, they have to go through training to understand why and how to advocate. The second activity is to conduct research to understand the depth and breadth of the issue. And then they either will go to the media to discuss their issue to get public support and then engage stakeholders.
This has empowered business member organizations such as the Ghana Association of Medical Herbalists, GAM, to engage with the relevant stakeholders within the health sector.
The group was formed in the year 2005. It was when the first batch of the herbal medicine students graduated. Then they realized the need to come together so that together they'll be able to champion the cause of herbal medicine and practice in Ghana. The big challenge has to do with the fact that after school, instead of being seen as part of the healthcare delivery system, it wasn't like that. And as a result, going out of the system became the order of the day.
Until I graduated in 2009, I realized the frustrations and the challenge outside was more.
What happened was, after meeting with various stakeholders and not being successful, we had a series of meetings with members. Prior to that, I had seen adverts in the papers by BUSAC. So upon further inquiries, we came across Smile Ghana, and they are service providers to BUSAC. So we had a meeting with them. Then it came up that they'll be able to assist us get to BUSAC to source for some funding or grant to embark on an advocacy. That will make it possible for us to meet various stakeholders involved in the implementation of the integration. So through the assistance of Smile Ghana, we were able to get to BUSAC with our proposal, and God being so good, we were successful.
It is always good to look at where the service providers are.
When a business association is given a grant, this is the first thing that is done, that you take you through the process so that you are able to advocate better. It is important to advocate to get the public sector to understand the challenges that the private sector has in going about normal business. And therefore we go through what is it that your challenge is, how do you understand the challenge, how do you convey that challenge to the public sector, and what do you expect from the public sector to do in resolving the challenge that you have.
We're going there the militant way. Normally we're going in numbers, and we were not ready to listen to them. So it came to a point, stakeholders were also not willing to listen to us. So after the training, Per the skills and knowledge acquired, we're able to dialogue with them at their level and they also at our level to come to a compromise. Initially, we went through the background of BUSAC, then also through advocacy, what advocacy is, and why the need for advocacy and the tools needed in advocating.
With the help of BUSAC, we were taught how to, one, the various types of advocacy. We were taught that you don't get up one day and say, I'm going on Aluta. But we were given the various kinds of ways to lobby. And then also, aside that, like we were given so many things, what we must do to be able to get the attention of a leader or of someone in authority. And I believe that has really helped.
For months of sustained advocacy activities engineered by BUSAC Fund, GAM's toil in business advocacy was rewarded in January 2012. Today, members of the Ghana Association of Medical Herbalists can be found in hospitals such as the Lojikuku Krowo Metro Hospital, the Police Hospital, Kumasi South Hospital, Obuasi Government Hospital, as well as the Takwa Government Hospital and the Whole Regional Hospital, to mention a few. In all, 26 members can be found at public health facilities across the country.
With a new government policy that every hospital must have a traditional medical center, some of you have also joined with the district hospitals, health centers to open your practices. Traditional medicine is a major and traditional medical system. The work that you are doing, it has been practiced for thousands of years.
After the BUSAC program, we had this place, and you could see that apart from the building being new, everything in it is also new.
If we talk of disease that comes to us, they are numerous, but we are guided by the standard operating procedure or the manual. Per that, we need to attend to 14 disease conditions. So if the disease condition falls outside the 14, then we need to refer you.
On average, we treat between 6 and 12 patients a day here. Our highest number has been 24. With the help of BUSAC, we've reached where we are now. Honestly, when we first met BUSAC, I thought that it was one of the numerous hypes that normally comes around. But after the program, I saw that the perception is different.
It's a very good initiative. That is why, as medical herbalists, we are all happy that herbal medicine is now integrated into the main healthcare delivery system.
The pilot services of herbal medicines came as a result of a lot of scrutiny. And it has been a long policy over 3 decades now that if we found something good out of herbal medicine, they will be integrated. That is the base policy. Until we got, KNUST came up with a bold concept in 2000 to train a physician assistant at a physician assistant level, someone who can at least diagnose and prescribe common diseases in some 14 to 20 areas that have been selected.
The school was established to really put scientific approach into the herbal medicine industry, and that formed the basis for establishing the department. Really, they are put through clinical training, and this is done with a number of institutions, the medical school, the Konfanachi teaching hospitals, the university teaching hospital, and the pharmacology, all relevant areas, including even the social sciences. Then we take them through phytotherapy, that is after the clinical training, diagnosis and prescription. We then have to take them through the use of herbs in treatment, and that is phytotherapy. These two form the core of the cause.
The BUSAC-GAM collaboration, according to stakeholders, has been very helpful.
We are gainfully employed now. At the end of the month, you'll be paid. That for us is a huge benefit. Another benefit will be that those who go into cultivation in a way will get employment. There will be more production of various herbal medicinal products, so manufacturers too will, as it were, get more profit at the end of the day. Then also we can decide to export whatever comes out of the cultivation. It can also serve as a means of tourism for others who are interested in medicinal plants. So for me, we have immediate benefits and future benefits.
The integration, I would have seen it by now, it would have even been dead without the support of BUSAC. BUSAC came to revive something which was dying. It was when BUSAC came in to assist the Ghana Association of Medical Herbalists to pursue the agenda of seeing herbal medicine integrated into the health system in the country that we began to see lights at the end of the tunnel.
When a student came out first, I think there was a whole lot of confusion, even placement in the ministry. And it was the help of this collaboration that they managed to have workshops, conferences, and eventually managed to present papers to the ministry. And now, to the extent that the ministry has now accepted the herbal interns, they are graduates, praise them on a scale. Now the district and regional hospitals are by law to establish herbal units.
The impacts are significant in terms of outcomes, and therefore it's worth continuing.
In spite of these achievements, both GAM members and stakeholders believe that herbal medical practitioners could do more if their services and cost of drugs are covered by the National Health Insurance Scheme.
Everybody knows that National Health Insurance has come and it has come to stay. And herbal medicine is not included. With the help of BUSAC, as they did some time last year, we know that if they give us that resource that we need, we can cross this hurdle.
The survey we conducted and the 17 pilot places that government has initiated was that people who goes for medication, most of them are National Health Insurance card bearers. And everybody is expecting to take these medicines once he's having the National Health Insurance card. But now that traditional medicine is not included in the National Health Insurance package, they are being disenfranchised, and these people usually walk away taking allopathic medicine not to their satisfaction because they don't have funds. That is why we are saying that for this integration exercise to move smoothly, there is the need for the inclusion of traditional medicine into the National Health Insurance package.
You see, the problem initially was that get these people integrated. But integration doesn't just mean making them visible in the hospital. It's to make them useful. But as the situation stands now, there is a high redundancy rate among medical herbalists in the various hospitals because their services have to be paid for, unlike the Orthodox members.
We want to use this medium to plead to potential donors and BUSAC that we want to embark on another advocacy to make sure that policymakers, stakeholders realize the need to make sure that insurance covers herbal medicine services.
We think that if BUSAC could help the medical herbalists to push forward again an agenda to get their services covered by the National Health Insurance Scheme, then this process will be complete.
All these has been made possible by the Business Sector Advocacy Challenge Fund. Thanks to the BUSAC Fund and the judicious use of business advocacy, herbal medicine practice in formal healthcare system has come to stay.
It's really a concrete example of we want to see results, and with BUSAC funds we see results.
BUSAC also showed that the results that have been achieved so far is quite significant, also compared to what Danida is supporting in other countries in terms of business advocacy. So altogether, I think we are very happy with the support that has been going on so far, and we just need to continue to be very ambitious in the business advocacy area for Ghana.
The judicious use of business advocacy by BUSAC Fund with support from their development partnership, namely Danida, USAID, and the EU, has proven beyond doubt to be an efficient and effective tool.